A prostate biopsy is the term given to taking a small tissue sample of the prostate, which is an organ which rests between the bladder and the water pipe. Now, all men have a prostate. As men grow older, the prostate grows bigger, and sometimes that there can be cancer that develops within the prostate. So prostate biopsy is a way of taking a small amount of tissue out from the prostate to see if there is cancer within the prostate and look at it under the microscope. A prostate biopsy can be performed either under local anesthetic or it can be performed under general anesthetic. So preparation for the biopsy depends on how the biopsy is going to be done. Now, if it is a local anesthetic procedure, the preparation is fairly minimal. You will get clear information from your provider about if you need to take any painkillers before, if you need to take any antibiotics before, and if you need to fast before the procedure. Most often than not, a prostate biopsy is almost like what we call a day case procedure, where you come in and you're able to go fairly quickly after the procedure, provided you're well from it. So the results from a prostate biopsy are available fairly quickly. It also depends on where you have the biopsy, whether you have it within the National Health Service, the NHS, or whether you have it in the private service. And most often than not, in the private setup, the biopsy results are available within a few days. It might take a little bit longer in the National Health Service. So prostate biopsies by themselves, if they are not guided by any previous imaging, are not very accurate. And that is why we've moved to now getting some form of imaging, which most commonly and routinely is an MRI scan of the prostate. So you will probably have a prostate biopsy only after getting such a scan, and only if it shows or suggests that there is possible cancer within the prostate. So when it is guided by this sort of scan, the accuracy of the biopsy is much higher, and it is something that will only be done if it needs to be done. A prostate biopsy is very safe. Techniques have evolved to reduce all side effects from such a procedure. The most common side effect from a prostate biopsy is pain and discomfort in the area where you have had the biopsy, which lasts for around a day or a day and a half, and then it disappears after that. You might notice some blood in the urine. You might notice some blood in the semen for a few days to weeks after the procedure. There is a very, very small risk of an infection requiring antibiotics, and this risk of infection has been minimized by the new techniques of doing the prostate biopsy through skin rather than the back passage.